bag, my jacket, and a note that just says, "Don't forget your water."
Beautiful.
The sun is like staring right at me. Like I feel like I don't even know. So I just wanted to give a quick little rundown of what I did. So we did like meds and stuff, like watching the nurse take them out of the Pyxis, and which is like the automated medication machine. We gave 2 bed baths, me and my friend. We did one in the morning, one in the afternoon. So I drained a Foley. A Foley is basically something that goes inside a woman's not her vagina, her urethra, or a man's urethra, and their penis, and basically catches the urine for them. Like if they're incontinent, or like if they can't walk to the bathroom, like they'll be ordered for one. So I emptied out one of them twice, and basically like there's a bag and then there's a box, so you basically just tilt the bag back into the box, and then the bag has like measurements, so you can see their output. It's important to monitor that, like if they just came out of surgery, if they're having kidney issues, anything along those lines. So that is recorded along with like their intakes, so like how much seltzer they drink, how much water, things like that. So I did that twice, which is cool. I didn't know how to do it before, so now I know how to do it. And then we added some that's not the word. We added some like heel protectors to help prevent pressure ulcers in patients that can't move as much and like constantly just have their heels resting on the bed. So we did that. So we did that for 2 patients. 1 patient we had to change. No, I'm good, thanks. We did that for 1 patient. Love you too. So we did that for 1 patient. And then I did some wound care. I basically, like, the orders were to just flush the area with some sterile saline and put some Vaseline and wrap it up. So I did a wound care dressing, and I did sterile gloves just to practice, and I did horribly. To be fair though, I'm pretty sure I took the wrong size, and they were just way too big on me, and it was just really hard to put them on. But it was technically a clean procedure, so it was okay that like the sterility and stuff was messed up. If it was an actual sterile procedure, I would have had to re-glove and open another set of sterile gloves. Then we had lunch. See, when we came back from lunch, we gave more meds and took some vitals as well. Just because with certain meds, like you need to make sure that like their blood pressure, their heart rate isn't exceeding or below a certain point, because when you give another med, you can potentially make that situation worse and harm them. Like towards the end, like when it was kind of dead on the floor, like the nurses had everything under control, there really wasn't much to do. We just kind of went around to different patient rooms saying hi, see who was like in the mood to talk. We found this one patient. They're super nice, talking about how much they love playing chess, and I showed them how to use Game Pigeon on their phone so that they could like text their family and like play games via the iMessage. Because of like all the issues happening with quarantine, a lot of patients don't get to see their families, or their families like can't visit. Obviously, they're trying to slow everything. And yeah, and I also helped boost a patient in bed. A lot of times this is done like when they're like sliding down a bed and like they don't have enough strength, upper body or lower body strength, to kind of just push themselves back up into bed. So usually put them in Trendelenburg, which is when their feet are above their head. They kind of just go with gravity, and you also kind of just take like a chuck or a draw sheet and just kind of help move them up so that they're not like uncomfortable like laying in bed and stuff.
I don't know how I forgot to mention this, but this was probably the coolest part of my day, was seeing a Jackson Pratt wound drain. It's days like this that I really enjoy because honestly, I totally forgot what it was. Sorry to my fundamentals professors, they're awesome, but I forgot. But we did that our first semester, and I just genuinely, like when I saw it, I genuinely didn't even recognize it. My friend was like, oh, it's a Jackson Pratt wound drain that we did in fundamentals last semester. We got to see the little bulb filled with the fluid, and one of the jobs as a nurse when you have a patient with one of these is to assess what type of fluid is in the jar. Not the jar, but the little suction plastic cup thingy. And the patient's was serous sanguinis, which was a mix of blood and liquid from the blood. If the output was clear and kind of like watery, it would be considered serous drainage. And if it was like bright and it was like blood, it would be considered sanguinis drainage. We also got to chart it in the chart along with the amount that was drained from the wound for the nurse.
The time kind of went by quickly, not really. There were some slow points, but again, there was a lot of students on the unit, so they had a lot of help today, which is better than not having enough help, obviously.